This is Dr. JANAKIRAM, Dr. SHILPEE, BHATIA, SHARMA, Dr. Amulya from India, and you're going to see a case of cavernous hemangioma of the cavernous sinus endoscopic approach. MRI showed a typical popcorn appearance, and you can see very clearly in this scan, you can see the cavernous sinus completely filled with tumor. You can see the tumor there right inside the cavernous sinus. All these scans showing that the anterior part of the cavernous sinus is involved. We start surgical video after doing a medial maxillectomy. You can see that we are drilling the posterior wall of the maxillary sinus here. This is actually a four-handed technique. You can see that we're going cross-code with the burr, and also and I'm using a suction as well. So this is a Karl Storz S3 neuro drill, and that has self-irrigation in it, so we love it. So here we are, we're just drilling off the posterior wall of the maxillary sinus, and just behind it will be the pterygopalatine fossa. We're removing that bone, and then once we remove it, this is the exposure of the sphenoid sinus. We then do a transpterygoid approach. We drill off the pterygoid wedge, and once we do it, you can see the median nerve right in the center of your picture, and that's the V2 canal. And now once we have exposed the tumor, we slowly, gently take off the eggshell bone over the cavernous hemangioma there, and you can see how beautifully the bluish tinge of the hemangioma comes into view. And posteriorly, we can see that the carotid artery has been shifted posteriorly, and I'm now elevating off the bone of the carotid artery. And you can see that this is a beautiful view of the play of colors actually. That's the carotid artery. You can see that whitish thing there, that's the carotid, and that's the cavernous carotid, and coming down, that's the paraclavial carotid right there. And once we elevate the bone completely, anterior to it is the cavernoma, the bluish color inside the cavernous sinus, very clearly seen there. And you can see that the navigation is being used, and this is the Doppler. So here is actually the V2, and now we're making an incision on the endosteal layer of dura over the cavernous hemangioma, just parallel to and anterior to the carotid artery. Since we have mapped the carotid, we know very clearly where the carotid is, and we knew that we're going to do an in toto removal. Just have to separate all these fibrous strands. And you can see that we're doing actually a very clear dissection there, having a very nice look. Dr. SHILPEE is giving me beautiful looks there. Bleeding was never a problem here, and since we are using both hands there, so the left hand was sucking all the blood, and intermittently we use Surgicel as well. So here we are now cutting off all those fibrous strands which was attached to the periphery of the tumor. You can see how beautifully we can have very good looks inside the cavernous sinus. Now you can see, once I'm going right inside, we can see the cranial nerves which are shifted. That's the cranial nerve. You can see very beautifully shifted laterally. So it was actually pushed laterally, carotid right there, and you can see that I'm now separating the tumor from the paraclavial carotid now. This is actually the sixth nerve coming into view, which is pushed upwards, and we knew that this patient is going to be totally normal without any palsies of the cranial nerves. Now we are separating this from the paraclavial carotid. You can see that now the tumor is being separated. You can see the paraclavial carotid now. That's in the 4-5 o'clock position. You can see how beautifully the carotid is seen there. And you can see every step is done, in fact, under vision. Even though there's a little bit of bleeding, we can see all these fibrous strands. So after separating it almost 270 degrees, you can see that the gentle pull was given, but the pull was not much. We were dissecting with my suction the fibrous strands. You can see that the left hand is doing the dissection there, and once we do the dissection, this is almost come out in one piece, and that is the cavernoma for you. The cavernous sinus completely removed endoscopically, and this is, to me, the right way to deal with this tumor. And then we did a cross-code Hadad flap and closed the defect. Thank you very much.